Hi, everyone. This is Angela Love-Zaranka with Lactation Education Resources, welcoming you today to our webinar on evolving evidence on the COVID vaccine, pregnancy, and lactation. It is my great pleasure to introduce Dr. Sekeita Lewis-Johnson. She is a board-certified family nurse practitioner, international board-certified lactation consultant, and birth doula. For over 20 years, her primary focus has been labor and delivery and maternal child nursing. She is one of the founding members of the Southeast Michigan IBCLCs of Color and owner of Mommy and Me Lactation Consulting, LLC. She is an instructor and lead nurse planner for Lactation Education Resources. Dr. Lewis-Johnson is an avid advocate for equitable and just policies and practices, especially related to Black maternal child health inequities. Dr. Lewis-Johnson, thank you for joining us today.
Thank you, Angela, and thank you for having me, because I wouldn't be anywhere else but with this esteemed panel that I had the privilege of already speaking to 6 months prior. So I am so excited and ready to kick this off. But I'll start with introductions. So we have Stephanie George. Stephanie is Oneida Nation. She is an international board certified lactation consultant and an Aboriginal midwife. Before she became a midwife, she was certified as a postpartum depression support person. She is well known for her work as an advocate for Indigenous health, women's health, and mental health, and as a breastfeeding educator. Stephanie continues to share her knowledge with healthcare providers and students through her roles with the Baby Friendly Initiative Strategy of Ontario and as an expert and panel member of the Registered Nurses Association of Ontario. Stephanie is on the board of directors for Haldeman Norfolk Women's Services. Stephanie teaches future and current healthcare providers by working as a sessional or seasonal instructor of Indigenous health at McMaster's University and as a member of the board of directors for the International Lactation Consultants Association. Welcome, Stephanie.
Ashkali.
Dr. Tomori is Director of Global Public Health and Community Health at Johns Hopkins School of Nursing. She is an anthropologist and public health scholar whose work addresses maternal child health, breastfeeding, infant sleep, and health inequities. Most recently, she has been researching the impact of the COVID-19 pandemic on lactating families. And I will add that she's always updating everyone, including me. I learned so much. So I'll add that to my personal bio of Dr. Tomori. Thank you for joining us here today.
Thanks for having me.
Yeah. So on behalf of LER and our international audience, I just want to say thank you for joining us this afternoon. It's been about 6 months since we've last gathered for this type of discussion, and so much has happened since then. We now have more evidence to guide vaccine decision-making for pregnant and lactating people. And at the same time, it's safe to say that COVID vaccine is one of the most polarizing topics around the globe. And yet, as healthcare professionals, it is our role to help the communities we serve get accurate information that takes into consideration their values and preferences. So we are going to dive into these topics, and then we'll take questions from the audience at the end. Please feel free to ask questions and we'll address as many as we can. So we have a jam-packed session today, and so I'm just going to jump right in. We'll first be really talking about what's the latest that can inform vaccine decision-making. So I'll start with the first question by asking, what are the current recommendations for COVID vaccine for pregnant and lactating people? And To add to that, this is a two-part question. How have these recommendations changed from before? And I guess three-part, why did they change? There you go. That's it.
That's all.
All right. Would you like me to start on that one?
Yeah, jump on in. This will be questions, discussions, all of it.
All right.
Conversation.
So it is, I have to say, as I was thinking about this, and this has been like a touch point throughout the pandemic, our panels, which I've enjoyed tremendously. And at the same time, it is just overwhelmingly difficult because it's been so terrible to watch the preventable deaths and suffering in the 6 months that have passed since we last did this panel. It's just been terrible. And the inequities, of course, are profound and continuing to be so. So to address the recommendations, the really great news is that they have strengthened over time. So as we have had more evidence, robust evidence on the safety and efficacy of these vaccines for particularly for pregnant people, because lactating people have already had the recommendations in place. But because pregnancy is a special physiological state, the time in terms of enrollment of trials and getting data was unfortunately delayed because, and we talked about this before, but it's really important to know that there are inequities from the start. So pregnant and lactating people were not enrolled in the initial trials, which as far as I'm concerned is inexcusable and should never happen again. And that delay is what we're now dealing with downstream. And so unfortunately, we just had months of time in getting some of the data, initially, preliminary data, and then actual trial data, and all of that has come to bear and really has gotten even stronger over the months that we have spoken. And so we now have very clear recommendations, particularly for pregnant people who didn't have those clear recommendations before, unfortunately. And so we had earlier, we already spoke about this, I think, at the last time, that the recommendations were sort of happening, but not with the force that we wanted. And then over the summer is when we really had very strong, concerted recommendations from professional societies, from the CDC, and of course multiple other international bodies. But really, we had sort of a delayed but very strong set of recommendations that pregnant people can be vaccinated, and not only can they be safely vaccinated, but that in fact they are recommended to be vaccinated. And unfortunately, the reason for that recommendation was that we also started having data about the higher risk that pregnant people are at from SARS-CoV-2. And that data, unfortunately, has only strengthened as well during this last awful Delta wave in the United States, because we had basically unmitigated transmission once again. And so because of that data, there was actually a very recent advisory that even strengthens the recommendations further. So we had the recommendation over the summer in the US, but then they were particularly called out because we were starting to see this devastating data of pregnant people being hospitalized, of receiving intensive care disproportionately, of having to receive the maximum level of care that one can have. And we were seeing deaths among pregnant people, and just horrible outcomes, including terrible birth outcomes as well, and stillbirths and premature births. I mean, it was just a devastating set of reasons for why those recommendations have strengthened. So if there's one takeaway that I would like to have from this panel today, is that if you are pregnant and you are thinking about getting vaccinated, this is absolutely 150% the time to do it, and to protect yourself and the fetus, and that your life literally depends on it. If you're caring for this population of people, you have to talk about this, because some people that if you don't talk about these things, they may actually die. And we do not want to lose any more people. So please, 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 this is my big one takeaway from this panel. So I'm sure I'll come back to it, but that's my main message for today. So I'll hand it over to Stephanie.
Yes.
Yeah.
Everything
Wow.
that Cecilia just said.
Okay.
So,
Okay.
I
Yes.
mean, so I work on a reserve, and right now, even with the big pushes, we are at 51% double vax rate, and we have 44% with one dose. When the Delta wave hit, a lot of clients reached out to me that were still nursing, asking about the safety. And it's hard if they're with somebody who doesn't believe in the vaccine. So the best thing I could do was to send them information from non media sources, because if it's on CNN, they don't trust CNN. So I was finding some good articles with great science to get their partners more on board. Now we still have people who there's a big fear I said this last time, there's a big fear in Indigenous country over anything that comes from the government that's mandated. And that fear runs very, very deep. And it's a logical fear because of what has been done to our people without consent. I know in Canada, they put the federal government put Indigenous people on the top of the list to get the vaccine, and people jumped down their throats because, well, it was still in the testing phase, which some people really like to hold on to. So with the women that we work with at the birthing center, I say most of the time, as long as you're clear and unemotional, they're listening and they are starting to get their vaccine because they're listening to the updates in the science. And I put it, whenever I see something new, I just throw it on my Facebook page without comment. I think I just see it as baby stepping in our communities because there is such a big fear. So I'm grateful that more of our women, pregnant and lactating, are choosing to get it, even if they're scared.
Yeah. Thank you for acknowledging partners in this conversation, Stephanie, because all too often, even when I think about lactation and pregnancy, the partners are like, happenstance, like they didn't have anything to do with the parts of it. And we know that partners also can be influential in infant feeding decisions, right? And so why wouldn't that be the same with vaccinations, right? So I can see how challenging it could be, particularly in certain populations where, already there were downstream issues, as Dr. Tomori pointed to prior to COVID, a lot of issues, right? And now we're adding this, and we're also still not really considering the whole family-centered approach in that there's a partner and there's other folks that the pregnant and lactating person hold to higher esteem than officials from the government. So thank you for bringing that. So the next question is really a general question about the climate in North America. Dr. Tomori, you spoke to what's going on with pregnant folks a little bit who contract COVID. And so before we knew that, yes, there was alarming data over 6 months ago about if you were pregnant, you were you had a higher likelihood of complications. But let's talk about that. So are there any differences in rates of morbidity and mortality in other parts of the globe regarding pregnancy?
Yes, unfortunately. So this is happening elsewhere too. There was, because different countries have different levels of collecting this kind of data, and you can kind of see this bias that we talked about, right? The non-enrollment of these people early on in the trials, and then the not adequate systematic data collection on people who are going to be overlooked systematically, right? So this is the problem that occurs elsewhere as well. But there are some settings that have excellent record keeping. And for example, the NHS in the UK provides some of the best quality data because of their sort of infrastructure for data collection and reporting. And they also have seen extremely alarming data and saw disproportionate number of pregnant people being represented in the acute care kind of settings. Absolutely terrible. So I believe that the latest numbers were around 1/6 of people in like the highest level of care being pregnant people. I mean, that is just astoundingly high, and you can really see this early communication gap and its results. So the time that we lost in having the trial data and clear communication to people means that people weren't sure. In fact, some providers were not providing a very balanced discussion about what would happen to people if they were not taking the vaccine. And this is after, we already started having really quite high quality data from the last time when we were talking. We already had some of this data on our hands, and yet the recommendations in not the professional societies were already on board, but individual healthcare providers did not necessarily have a good handle on the recommendations. And they also themselves may be hesitant. So they were not providing some of this to people. They were not even telling people necessarily. And so what you then see is this terrible set of outcomes, here and elsewhere. Lots of confusion. And, just to put what Stephanie said in context, and I, of course, I'm dismayed by 50-some% uptake-ish, but I will say in the US, among pregnant people, we are talking about 30% of people right now who've taken the vaccine during pregnancy. And then we don't know exactly what happens to them postpartum. So we are missing a whole lot of people who were recently pregnant, who are lactating, who are also maybe not being told information, or who are being told that they can't breastfeed still, which is absolutely untrue. Absolutely can breastfeed, and it's recommended to breastfeed and get vaccinated. So this kind of lack of clear, consistent guidance in the last 6 months and before has really taken an enormous toll.
Ooh, Dr. Tomori, you said some things that is resonating right now in my mind and my spirit about misinformation from even healthcare providers, right? And in this world of disinformation, misinformation, however you want to describe the information, we talk about more so the narrative being lack of trust, right? Lack of trust. It's the lack of trust, but it's really on the onus of healthcare professionals, institutions to gain the trust. And how can folks gain trust when you got all of these different folks speaking different languages? And when you spoke about data collection, we know in certain areas, data is not even being collected on positivity rates, all of that. So it does continue to lend confusion through no fault of the public. There is a responsibility that healthcare providers have in doing no harm. And so we could talk for days about that, but I'm going to move on in the interest of time to get our audience as much information as we can get out there. So SARS-CoV-2, which is COVID, but SARS-CoV-2 antibodies are detected in mother's milk post-vaccination. Can you explain the significance? And also, can you speak to the antibodies in human milk that fight SARS-CoV-2?
Sure. So we already knew early on that, and this, just back to the the entire sort of construct of lactation. So lactation is an evolutionary adaptation. It's a mammalian adaptation, and part of its role is not only food and liquid, obviously, sustenance for the infant, but one of the primary roles is to protect the infant from infection. So this is one of the biggest roles that it plays in our evolutionary history. And so we knew from the beginning that human milk has, antimicrobial properties in general and antiviral properties specifically. And we also knew that based on what we know about how it works, there would be specific antibodies that will be made to the virus. And of course, that was then shown in the scientific literature. But again, none of this is a surprise. And so we knew that was happening before we had vaccine availability, right? So we knew that it was important to continue to breastfeed because the infant would receive these antibodies during lactation. What we have now added to this knowledge base is that this, of course, happens during vaccination as well. And so the vaccine, as it trains the lactating person's immune system, it's also generating a response that can be transferred to the infant, which is super neat, I think.
So amazing.
It's one of those really, things that geeky people like me, geek out about. So I'm always excited. I'm like, yay, this is so exciting. And so that was really wonderful. Again, expected, but wonderful. And so it, in terms of, the degree of protection that these antibodies confer, I think that those studies are going to take a lot longer. But just as we know about why it's important to breastfeed if the person is unvaccinated, similarly, we also know that after vaccination, we have some of the transfer of immunity to the infant, and that confers benefits. And because we know that infants are not going to be eligible for vaccination for quite some time, this is sort of the only form of protection that they will have. So this is I think, a very important piece for people to know. So vaccination not only is beneficial for the person who is getting it, but for a pregnant person, transferring that immunity to their fetus, and then during lactation, also transferring immunity. So it's a very community-based approach.
Yeah. Stephanie, anything resonates with you at all?
Oh, absolutely. So, as Indigenous people, we are one of the main tenets of our beliefs is that we watch out for the community. We aren't supposed to be self-centered and only think about us. And when you look at what the Navajo Nation has done, they had their own people enrolled in the studies. So when it was proven safe by their community members, I mean, their uptake, they're almost, last I read, they're almost at herd immunity, which is fantastic. Like, can you imagine? So, and I think when it comes to lactation, we believe that it's, I mean, non-Indigenous people believe it too, that it's a medicine. So when I tell my clients that, the babies were the first beings on Earth that got antibodies and that got these antibodies through mom's milk, they're the first people that were immunized on this planet because creator values our babies so much. And when you put it in those traditional terms and like according to our beliefs, it really resonates a lot more than just what stats can say. And although stats are needed and stats are wonderful, we need to just, for as Indigenous people, we need to remember why we nurse in the first place. And it's to protect, it's to keep our babies close, it's to love. And one of my clients that ended up getting her immunizations, she said she's going to be pumping and hiding it in all of her other children's food, the ones that are under 12, so they can get some of those antibodies into them, because once she got on board, she is unstoppable.
I love that. I love how you phrased community first, and also how it translates and it's operationalized. Like, okay, I'll save this milk for everybody, not just the baby. I just love that. Thank you for sharing that. So to date, so before I go there, I want to just be clear about the recommendations. So the recommendations are suspected or confirmed to have COVID-19. The recommendations are to feed, right? Before, I know we said that in so many other different ways, but I just wanted to get that out there before we move to the next question. So I'll start with you, Stephanie. To date, have you heard of any cases that have been reported that COVID, or that has been reported that COVID was transferred or transmitted, I should say, to the infant via human milk? Any cases at all?
Not personally. Nope. Nothing.
In the literature?
I will. I don't.
No.
Yeah.
Okay. All right. Dr. Tomori, you want to, so to date,
Sure.
have any cases been reported that COVID has been transmitted to an infant via human milk?
No, so there, okay, so this is all, as always with science, this is complicated, but basically we knew, and it's the funny part about being with you for multiple months, is that, we knew it's a respiratory infection. And so we had experience with other respiratory infections, and we knew that this was very unlikely. Other people were less convinced because they probably knew very little about lactation. But this is not a surprise. And so once people started looking at the data, what some people suspected to be potential transmission from milk turned out to be not from milk. And of course, all of this became much clearer with better understanding of how actual transmission works, right? So just to remind people, because I don't think we really emphasized that so much 6 months ago, this is a virus that is transmitted by breathing, right? So it's aerosolized particles that we're breathing, and those photos when they show those particles and how far they can go give you a sense of how that works. And so this is why some of the more recent recommendations, which I think still have not really been implemented, have been so important for protecting our communities that we're talking about. So ventilation became much more important in the last 6 months. And that has to do with increased recognition of material that people already warned us about, which is that it's a respiratory virus that's transmitted via aerosols. High quality masking became much more important. So it matters, the kind of mask you're wearing matters for filtering those particles. Filtration of the air became much more important. So I think that is the direction where we have gone. And it's become increasingly clear with study after study that it's not milk that may be transmission. It is those respiratory aerosols that are being transferred through the air that can linger in the air, unfortunately, which is why you sometimes have transmission that isn't like right next to you. So it's not necessarily me having a conversation with you, although that exposes you to a lot of those potentially infectious aerosols, but they can go farther than that as well. So I think that's just adding a little bit more dimension to the context of this, but we're not really concerned about transmission via human milk at all. We are concerned about those respiratory aerosols.
Thank you. Thank you so much for explaining that. Totally makes sense to me. And so, thinking about proximity and thinking about that now, the mask, the type of mask mattered. Like that is progress. That is the evolving information that's going to continue to come out. And not that the prior information was incorrect. It's that as we learn more, the recommendations will become more clear and make more sense. So we're going to switch gears. We're going to talk about the narratives. And we talked about misinformation before, but I want to ask a really direct question. What are the narratives that need to be dispelled about SARS-CoV-2 or vaccines? What is the key message? And I would love to hear from you, Stephanie, and then Dr. Tomori.
Well, especially in my community, the main thing that has to be dispelled is that you're going to get sicker from the vaccine than you are from COVID. I mean, when I was on here last time, I discussed my cousin who was just diagnosed with being a long hauler, and she's still like she's worse now because the clotting has started, and now she's having TIAs. And there are very, very minor risks of one of the, I think it's the AstraZeneca, or the Johnson & Johnson, sorry, I can't remember which one, that that could, thank you, that could cause the clotting. But I mean, looking at what my cousin's gone through, I think that's the biggest thing. I mean, I have something called mast cell activation disorder. So I reacted to the vaccine. I have a great job where I could stay home as I was recovering and still did my home visits when needed. But I'm the type of person, if I catch COVID-19, I could become a long hauler like my cousin. So people just need to know, even if you get sick from the vaccine, it is going to be so minor as compared to actually catching that.
Thank you. Dr. Tomori.
I agree. I think that's probably the number one. If we had to pick one, this is it. I think people believe because of misinformation that is targeted, particularly to, marginalized communities, which is just profoundly unethical in every way. But that targeted kind of misinformation and, for our communities that we're talking about today, anything to do with reproduction and children, is a hook for this kind of targeted misinformation. Some of the people who are doing it are even people who are either pretending to be healthcare providers or apparently are healthcare providers, which is probably one of the most dangerous forms of this. But it really is just completely false what they're saying. It's really, really important to understand that the side effects that vaccination may cause are a fraction of the potential problems that COVID may lead to. And the result that we see down the line from this kind of targeted misinformation is what I'm watching among, my network and network of healthcare providers, them taking care of dying pregnant people and dying new mothers and parents, which is a horrific experience, even as they're watching, and they can't always stop these horrible things from happening. I have had colleagues who are making hand molds of, nursing colleagues of mothers for their infants who are going to be orphaned. It gives me, like, I feel it right now, what that means. And I cannot communicate it in stronger terms that this is a life-saving intervention for the pregnant and lactating person and potentially their infant as well. So it is really so important to understand that we need to look for reliable, trustworthy kind of information from people who actually know what's happening. Like you said, Stephanie, getting people linked to the correct sources of information can make all the difference in the world. So that would be the top.
That was powerful. And Dr. Tomori, thank you for sharing about the hand mold, because as a former labor and delivery nurse, I know that we used to make footprints for moms and families who experience loss. But now to think that we're making hand molds. Wow. Wow. Ooh, okay. Let me see if I can keep it together to go on to the next question, because this is some heavy stuff. So since the pandemic, there's been a decrease in donations of human milk. And this is one of those things that we know our most fragile babies need. So babies are still being born prematurely. We know that, and oftentimes, sometimes born prematurely because the mom or pregnant person has COVID, right? So these babies rely on human milk as preventive and life-saving medicine. It truly is medicine. So can you explain why this is concerning and whether or not whole term pasteurization, inactivates SARS-CoV-2?
I'm grateful for the discussion we had before we started because I got updated on this information too. So the recommendation is still to donate as long as you're not symptomatic, as long as like you still can't pass it on to people. So outside of that, it is still safe to donate. Remember, it has the antibodies. And then the Holder pasteurization does inactivate the SARS-CoV-2 bug, for lack of a better word. So it's still very safe. And I mean, especially if you've had COVID or if you've had your vaccination, those little babies could use all those antibodies that they can get.
Yes, yes. Whew. Dr.
I threw you
Tomori?
off. I'm sorry. I was debating whether to share that, but I think
No,
it's
I'm glad you did. I'm glad you did because I think it's important in framing the narrative. When we talk about values and preferences, right, of families and people, you develop those values and those preferences by being informed, truly informed. And sometimes we think that, oh, it's the data that can inform people. But I would say that it is generally these lived experiences that we don't really value as data, but it is data. So I say thank you for sharing it all, because we need to hear these things. We need to take these considerations back to our own respective communities and be able to tell the stories, real stories. And because when you're trusted in your community, people will believe you before they will believe these news outlets. And so, Stephanie, you spoke to that earlier. And so I just appreciate all the sharing. Yes, it's heavy, but I work in a heavy field and I can take it. So yeah, it knocked me off my square, but I'm back on. So, so here we go.
Oh, I know you can. I had no doubt about that whatsoever.
All right. So, are there any questions that I did not ask that you would like to address? I'm speeding up on some of our questions because, I really want to give the audience a chance to ask some of their questions so that we make sure we're honoring this space and getting as much information out for the people who may need additional information. So any questions that you would like to address before I move on to the audience?
I was thinking just about, what can people do to protect themselves now? Just a quick, reminder. So, our main message, I think that we all share today is how important it is to get vaccinated and to speak to people in your communities that you care for, especially if people are pregnant and they have recently given birth, they are probably missing their vaccination because the majority of them have. We know this from the data, and the data probably don't capture all the underreporting either. So it's probably worse than what we're seeing, and the disparities are terrible. And you can view those disparities on the CDC COVID tracker site. So that's step one. But what else could you be doing? It would be good to keep talking to community members about how it is important to look out for the community. So as we are getting people vaccinated, we still have millions of people who are ineligible to be vaccinated, all the people under 12, of course, and of course, all infants for a very long time. Everybody who is immunocompromised, who may not be fully protected, everybody who is, for example, a transplant patient them, people who have had barriers to getting vaccinated, people who have disabilities. There are so many groups of people who are not able to reap the full benefits of vaccination. So as communities, we need to look out for them, exactly as Stephanie said. That's something, values that really need to be viewed collectively throughout all the communities that we're part of. So keep talking about those multi-layered approaches. Keep wearing high quality masks like N95s, or there are different versions, of KF94s. These are all high filtration kind of masks that can be reused many times. Our healthcare workers, unfortunately, have had to reuse them for many, many times. And we know that they're still efficacious. So you don't have to throw them away after a single use. And that makes them more affordable. It's if hopefully we will have more support for this, but getting some of the rapid tests might also be helpful, hopefully ideally provided by the government, but getting some or donating some if you're able to other people might be helpful so that we can detect infectiousness in the moment. And really still paying attention to, ventilation, opening those windows, filtration. There's some great online tutorials for how to make sort of our own filtration units because they're not always provided, for example, in indoor settings like schools. So helping communities with multiple different approaches and looking to the experts who have really specialized in aerosol transmission can be really helpful to reduce the risk for the entire group. So looking out for one another, I think that's my last main point that I want to make sure everybody hears, because our particular population is connected to everyone else, right? It's not like pregnant people and lactating people live on islands by themselves on their own, right? They're interacting with those communities. And so we need to look at that in that context. I think if we think about it that way, it's a more helpful approach.
Yeah. Or we could create an island just for pregnant people. No. Okay. No, that's a whole different.
Well, apparently that's like, one of the strategies that people continue to recycle, that, people who are at higher risk, they just need to isolate somehow. I would love to see how that works in practice.
Yeah, I'm saying I think I would have had a ball being pregnant on an island with other pregnant people. Come on, no, I'm just playing. Okay, so getting back to some seriousness here. There's some questions in the audience that I think are awesome questions. I'm going to read the questions in their entirety because I believe all words give context to the question. So, first question is, good morning. I am not sure if you'll get to this, but I've heard from a few women in my area that their milk dried up after getting the vaccine. Do you feel this is just a coincidence or could it be a side effect?
I would say it's a coincidence. I'm wondering if a child was going through a growth spurt at that time, or mom wasn't feeling well enough to keep draining her breast to maintain her supply. I haven't seen it at all in my practice.
Okay. All right.
We got to watch that one, because I think that that's another piece that has been used as misinformation. So I suspect that may be another source where it's coming from. If someone is experiencing challenges, then you should ask for help and keep feeding the baby. But there's zero evidence, none whatsoever, none. And we would have seen it because there's millions of people, right, who have been feeding their babies and getting vaccinated. So if there was anything, we would have seen it. Nothing of the sort.
Thank you. Thank you. Thank you. I had not heard that, so I was very interested in your comments. So thank you. The next question is, what is the recommended gestational age to vaccinate, please?
Ooh, that's a good question, Cecília.
That is a good
right
question.
away. Okay.
Yeah, so this is one of the other problems that we had. I mean, we had so many problems, but providers, for example, were suggesting that people delay vaccination, and then some people died as a result. No need to delay. So you can get vaccinated. We have the wonderful safety data now. So you can get vaccinated and it will be fine. everything will be wonderful. And thankfully, again, just a reminder, because I think we didn't mention this, we've mentioned it before. These are not live vaccine. There is no live virus in that vaccine. So there's no concern about that if your body is getting trained to respond to the virus. So that's that. So yes, so get vaccinated at any time, including if you're planning to have a baby. We had that too. Apparently, some people who were planning to have a baby were also being told to delay. I mean, seems to me like everybody who is potentially reproducing was asked to delay, and that's actually just false. So get vaccinated if you're thinking about having a baby, because you don't want to be having COVID. So get vaccinated if you're planning or if you're pregnant.
Thank you. Good stuff here. Next question. Where do you recommend we go for continued updates in the evidence that we share with our patients who desire to be well informed? This is a great question. And I think for me, when I think about this question, I also think about health literacy. I think about how information translates to people, individuals, and how they make sense of it, right, to their bodies and themselves. So what can we share about these continued updates of evidence?
I think we have some challenges. I think that's why the CDC decided to do the advisory that went beyond the sort of regular guidance, which is supposed to be in plain language, but it can still be difficult to access. So if you are looking for up-to-date advisory information, and we can share that resource from the CDC that came out that shows here's why it's so important for pregnant people and people who've been recently pregnant to get vaccinated. That one is actually fairly accessible. If you want to look at the actual evidence base, the CDC also highlights that for providers. And then, of course, professional societies is where some of that gets really collected and discussed in detail. So we had the Society for Maternal Fetal Medicine, for the American College of Obstetrics and Gynecologists, and international organizations as well. The WHO also, of course, always has information, and each nation has their equivalent of US CDC. So there's more of that kind of evidence being collected. So you can always find that information if you're looking for the technical side. I think that the challenge, like you said, is accessing, so translating that information for community members clearly has not been done adequately, because if we have done it, then we would not be seeing these terrible disparities and outcomes. So I think that that is the key. So we have it, but the translation piece is clearly insufficient. And that to me is a public health failure. So we should be doing that. We should be bringing that to people, both through providers, but through communities as well, like you said, Stephanie.
Stephanie, you want to add to that at all?
Cecília was very thorough.
Yeah, I know. I just don't want to leave you out the conversation here.
So, I mean, when I asked so when clients have reached out to me, I ask specifically what they're worried about.
Yes.
And then I will find a website that will give them the opposite. Like when I do lactation help, I say sometimes things that are completely different than what a midwife would say. So I say, breastfeeding help or lactation help is across the spectrum. Some things will be here, some things will be here, and somewhere in the middle is going to work for you. And that's how I approach the vaccine conversation too, because I help clients learn how to bottle feed when it's necessary for that family. And my clients that choose still not to get vaccinated, they know that I have to go full head to toe looking like Pikachu in my PPE, but I will still provide them care. I'm not removing care from them at all.
Thank you. Thank you for both perspectives. The next question is related to studies. And so I'll read it from beginning to end. We've been coming across lactating people who don't want to vaccinate because they state lack of long-term studies on the safety of vaccines for themselves and their nursing infant. They've expressed worries about the vaccine passing into milk, spike proteins from the vaccine passing into milk, and lack of studies to show there is no harm to their baby. How can we address this?
Right. So, well, the good news is that that the claims that are being made are false. So we actually have that data, and it's robust. It's about as good as you get. So really, really excellent data on safety. And one of the most important things to know, and we talked about this before, but worth reiterating, is that most of the concerns about vaccine safety have to do with the early period within the short term period after vaccination. There's no, we do not have any vaccines that have these kinds of, 20-year kind of effects. That is a anti-vaccine propaganda, unfortunately. So it's something that most people are not aware of, that vaccinologists, if you listen to them, I'm not a vaccinologist, but referring to those experts, they talk about how important it is to capture that early period for a reason, because that is where the side effects take place, and that's when we know what's happening. And like we said, these are not live vaccines. So the kinds of concerns about transferring the virus, they're just impossible, because that does not exist. In terms of the lack of evidence for any potential harms from the vaccine, because we have so many people. I mean, think about what's happened here is we have so many people who have taken the vaccine, including, now, thankfully, pregnant people, recently pregnant people, lactating, millions of lactating people. We would have been seeing anything that is potentially dangerous. There was never really any concern about lactation to begin with. That was an opening, that because we didn't have people in those trials, like I said, vaccine misinformation could just jump right in and make claims that were completely false, and we didn't have any trial data yet. But we have it now, so that those claims have no foundation whatsoever. There's no danger to the infant. In fact, the opposite, right? Instead of the danger, we actually have those wonderful antibodies coming through in human milk. So if it's quite the opposite of those claims. So I think that we can very confidently say those things now, because previously, scientists are always trying to be more careful and base their claims on evidence, unlike anti-vax propaganda that can make whatever claims they want. So now we actually have all of that on hand.
Wow. Okay, so I have 3 more questions left, and I'm going to go out of order for a minute, because I think the question I'll ask last is going to take some time to answer, but they're all important questions. So, are there any recommendations for pregnant women getting a booster after the 6-month mark?
Wow. I don't.
So
That's
yeah,
great.
okay. So the booster situation, which I'm glad we didn't
She's
get
the
to until
scientist.
now, is kind of a problem. So so theoretically, I think we are in the state where, once again, we're going to be having to make some suppositions based on what we have evidence for, and what before we necessarily have full recommendations. So we don't really. What we have is colleagues and experts who are certainly concerned about this population of people because they are at high risk. And so I think in that group of people, we have a movement towards thinking about boosters over time, because we know that there is lower protection from infection, not necessarily from hospitalization. So the really good news is that over time, our protection still remains really high, particularly against hospitalization and death, which are pretty important outcomes. I think it's going to be tougher to have very specific data on recommendations for boosters for this particular population, I think we're going to have more of this coming. And there's also a conflict between the WHO that would like to hold off boosters versus wealthy nations that have excess supply of boosters. So this is a tricky thing to navigate on an international front. But I think that providers that are making some recommendations for people who are at high risk for boosters. And we certainly can include pregnant people in that group. So it just depends on how people define that high risk population. And I think right now what we're seeing is provider-based recommendations rather than a generic recommendation, if that makes sense. But I think that is an evolve. I think boosters are going to be an area that we're going to come back to in the next few months because those recommendations are going to continue to evolve.
Thank you. Thank you. So it looks like we'll be having another panel though. Oh, this information just keeps coming. So next question. What do you say to people who've had COVID and refuse to vaccinate because they have antibodies? What would you say?
So for me, what the studies are showing that you get more antibodies from the vaccine than you actually do from COVID. And it's a stronger protection than just getting sick. I share that information, but it's still up for their choice. People who don't like taking any type of vaccine, they're a hard nut to crack. As long as we keep the discussion respectful. Somebody that I know, she's refusing and she had COVID and her daughter was hospitalized. But she still doesn't want the vaccine. They're just keeping their family safe. And, those are good guidelines for that family. And they feel safer with their choice. And if feeling safer is going to help their mental health and give them less anxiety, for that, like I'm thinking of that family right now, I'm supporting them in their choices because they're going to get lonely not being able to go out to restaurants or going out to the theater without their vaccinations. So I keep in touch with them.
Connection is the key, right? So whatever way we can connect to people is essential. I think it's really important for people to know that if you have been infected with COVID, you can still get it again. So just, reinforcing that it's still really important for you to get vaccinated, even if you have had COVID, because just to make sure that we are clear on those recommendations. And I think that it's a very tricky kind of landscape, but we want to make sure that people understand that when you become infected, your response can vary very, very widely. And so it's not the same. And we have really, really great studies showing how strong the protection is from vaccination. So we really would like all those people to get vaccinated as well. So it's a really important piece of the puzzle, and it's always better to get vaccinated than to not get vaccinated in this particular case. I think we're in agreement. We'll wrap up for you because we're losing you. But it was wonderful to be here with you, with both of you, and it's been a pleasure. And I'm sad to say that it looks like we are having to come back in a bit, but we are working towards reaching those goals so that the next time that we see each other, we're not going to be seeing these horrible news and the data that show the disparities between people who are pregnant and recently pregnant and other people. So I'm hoping to have better news next time. But in the meantime, everyone, please go out and talk to people about vaccination. Reach out if you have any questions. We're here to support you, and stay safe.
Yes, stay safe. I'm very grateful to be invited back. I always love our discussions.
Me too, if you can hear me, or if not, I hope you can read lips.
We got
Oh,
it.
it's like you got it. Okay. With
Thank
that,
you.
thank you. Thank you for having us. I want to thank our audience for joining in. I apologize for any questions we didn't get to. But again, we will try our best to stay on top of all of this information as it continues to evolve. Be safe out there. Protect yourselves and your communities. Goodbye.